part. So like she explained, you keep the compression going till EMS arrive, or you can switch with another person. So now let's look at the AED part so we can combine these three skills together. Alright. So for someone in cardiac arrest, giving CPR and using AED gives the person the best chance for survival. That's why we need the AED. So if you work in a facility, know where the AED kit is placed so that you can go for it. Every employee must know where all these emergency kits are. Let's look at the AED and then we'll start our three skills together.
When someone is in cardiac arrest, using an AED as soon as it's available may help restore a normal heartbeat and increase their chance of survival. Fortunately, learning to use an AED is nearly as easy as turning it on and following the prompts provided. The AED may come with both adult and pediatric pads or settings. Always use adult pads or settings on anyone older than 8 years of age or weighing more than 55 pounds or 25 kilograms to ensure the shock delivered is sufficient. Some AEDs turn on as soon as you open the case. For others, you must press a power button. Then, follow the prompts.
Attach pads firmly to person's bare chest as shown.
If needed, remove clothing covering the chest and wipe it dry first. Place one pad on the upper right side of the chest, just below the collarbone. Place the other pad on the lower left side of the chest, a few inches below the armpit. If needed, lift the breast to do so. If you need a reminder of how to place the pads, follow the manufacturer diagrams. Plug the pad connector cable into the AED if necessary, and prepare to let the AED analyze the heart's rhythm.
Plug in connector. Don't touch person. Analyzing.
To ensure an accurate analysis, make sure no one, including you, is touching the person by saying "clear" in a loud, commanding voice.
Clear.
Shock advised. Press flashing shock button.
Again, make sure no one is touching the person before a shock is delivered.
Clear.
Shock delivered. Start CPR.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10.
Keep in mind, the AED will not always advise a shock. If no shock is advised, immediately resume CPR with chest compressions until the AED prompts you to analyze again. If there is a second responder at the scene, you should work together. Teamwork minimizes delays in giving CPR and using an AED, which can increase the person's chances of survival. As the first responder begins CPR, the second responder calls for help and gets the AED. When the second responder returns, they kneel opposite the first responder, placing the AED where they both can reach it.
15, 16,
I have
17,
an AED.
18,
I'll set it up.
19, 20, 21, 2, 3, 4, 5, 6, 7, 28, 29, 30.
The first responder continues CPR until the pads are placed and the AED is ready to analyze.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20.
Clear. I'll take over CPR.
Shock advised. Press flashing shock button.
Clear.
After a shock is delivered, or if no shock is advised, the second responder immediately takes over CPR. Responders continue to switch roles like this about every 2 minutes. Whether with 1 or 2 responders, continue CPR and AED use until you notice an obvious sign of life, such as breathing. Other responders arrive to relieve you. You are too exhausted to continue, or the situation becomes unsafe. If you stop CPR for any of these reasons, leave the AED turned on and the pads in place. Continue to follow the AED prompts.
All right. So I'm going to demonstrate the three for everybody, and then we will pair. You'll be in 2 groups, and then one will coach the other. When the other person is done, then the other next person will take over. All right, so I'm going to start with the breathing. Everybody's gonna have one. Lisha, come. Come and get everybody one of these. Everybody will have one to practice with. Give everybody one. Let's see. Okay. So I'm going to demonstrate. We will be pushing all the tables to that side so we can have this space to do our demonstration. Then we will sit when we are done with all the 3 skills. I will save it some time. Then we move on to the other. That's the remaining? Okay, thank you. So this is called a valve. One-way valve. Where's my thing? Yeah. There you go. All right, you put it here. It's new. Wherever you get trained, if it's not new, for me, my old ones, what I do is that I soak it in hydrogen peroxide and water, half, and then that disinfected for the next week. But this ones, I have new ones, so I'm like, okay, this guy, we're gonna have the new ones. Yeah. So let's start with the breathing technique. So you watch me do all the 3, then you get in pairs to start it. So with your pocket mask and your valve on, this is how it goes. You want to make a tight seal. So this pointy part goes for the nose here, the area, and make sure this is not going under the chin. If it goes under the chin, it will not have a tight seal as you would want it to do. So make sure it's not under the chin. You make a tight seal. You make a C shape on the top and the rest like an E, like that. You tilt the chin and you give 2 breaths to your victim. All right, let's see. You see? So it rise and fall. You don't want to give a forceful ventilation or breathing. If you do that, what is going to happen is that inside the lungs, there are small bubbles in there. That is the place for gas exchange. I'm being a little bit scientific with you all. It's called the alveoli. So if you put forceful air in it, what is going to happen is that it's going to burst. So instead of saving that life, you're going to